on about getting all the way round on the mannequin. We're on about seeing how you're handling the scope. We're on about looking at, have you got an understanding of what's being said? It's not essential to get all the way round. Again, when we do the colonoscopies on the patients, we're looking at one, safety. We're looking at two, comfort. We're looking at how you're progressing. But the most important thing is to get out of your head that you have to get to the cecum. What you need to do on the first few that you're doing is get an understanding about what it is and how to handle the scope safely and correctly. A lot of you have been doing things that are okay, but there is a lot of things that you can do to improve. I can improve, Vakar can improve, Saad can improve, other faculty members, they all can improve. The reason why we do these courses is that we do the courses because, one, we like to share knowledge, but two, we actually learn off each other, and we also learn off yourselves. And when we come back and we teach what you would class as the fundamentals, the basics, it makes us come back to the basics ourselves. And if I'm finding it difficult, I will come back and I will go, what would I say to you at this time? And that's how you scope. So your hand has gone forward and up to 2 o'clock position. So your hand is doing this. There. Now bring this hand slowly up and clockwise to up. You're very reluctant, a lot of you, to actually use this. This actually helps. What you end up getting, tennis elbow. You end up getting carpal tunnel syndrome. These are things that are common. Cervical injuries. These are common now to people who do a lot of endoscopy. This hand, straighten and just, if that's the direction of the buttons, it will help the clockwise torque. Yeah. And vice versa. That's why I got you to straighten your arm, and that just enabled it then to, yeah, clockwise, anti-clockwise. But it's all dependent upon this angulation here. Yeah. His hand is in the wrong position. Right. So, if we actually stand here now and we look, this isn't a get at you, it's the penalty of coming last. Right. So the penalty of coming last is that we look at, how's he holding the scope here in his hand? How's he holding the scope here in his hand? What could he do to improve? When you see it on the screen, you'll see that the person scoping when you're not scoping is having difficulties. You're not there, I'm not there critiquing him, I'm there looking at what's he doing, but what could he be doing differently to actually make it more achievable. And when you're able to do that, it then helps you. So when you're watching, it's not about watching and saying, oh, he's done rubbish or he's done good or what have you. It's about looking at what he's done, what he hasn't done, and what in your mind could he have done slightly differently to actually make that more achievable. So if he's trying to get around this bend, what would you have done differently? That's the thing that you've got to actually think for yourself. And why is it he's finding that difficult? Is it because his hand's too high? Is it because this too forward? What could he have done differently? When you watch a scope on live patients, you'll see that we'll keep the scope going in a straight line. We'll bring ourselves round. We'll come back like this. If you hold the scope up like this all day, tension. Get rid of the tension. Yeah? So the other reason for doing that and looking at each other is that you help each other. Because when we're not around, you'll say, well, I noticed when you were doing that, and he said do this, but you have, or I'll come back in if I was one of you guys, and I'll say, What do you think? He said that I should have done this. Do you think, what do you think, what did you see? Because I didn't see that. You know, these type of things. So just making, as a group, that you're supporting each other as well. We're at the end now. Happy? So let's just recap very, very quickly. So in recapping quickly, what we're looking at is a scope that we switch off on the processor. We've gone through the processor, we've gone through position on the patient. If we look at position on the patient, we often have them in the left lateral to start. Left lateral to start because it's easy for us. If we were actually looking at a very difficult colon and finding it difficult to get round, we'd want the person on the right lateral because we couldn't get round the sigmoid. Once we get to the splenic flexure, having the person onto the back or keeping them in the left lateral will get you round into the distal transverse, but onto the back then enables you then to traverse the transverse colon. Once you come to the hepatic, putting the person back in the left lateral opens up the hepatic. Once you go into the ascending colon, bring the patient back onto the back, enables you then to progress down. So if you were to follow positions of the patient, then that's what you would do. However, if you're asking me how many times I change position, I may change position several times and I may not change position at all. I keep advancing until I can advance, then I'll change the algorithm. The scope, just for reminding you, will actually do what you want it to do. If I have my hand here and I want to place clockwise torque, you see I've got a fist grip, the scope won't go round. Even on the hand grip, the scope finds it very difficult to go round. See it? See how much tension? If you look at the thumbnail, and look at the thumb, the whiteness in the thumb. If I bring the hand up here, so now the buttons are pointing up to there, look at the thumb, there's no more gripping tightly. And I can control the scope. I can then re-grip the scope. Again, if I let go of the scope, which a lot of you do, to then reapply the torque has gone off and you can't understand what's happening. So to bring that on and maintain it, you can even do this. That maintains the torque. Then what you can do is bring the scope right round and then you can do your 360. And the scope is here. So using your scope enables you to do things. Hand position. If I was to actually ask you now to hold the scope in your hand just there, hold that scope like that. Hold it tight. Right. I want to hold it tight. I want to hold it tight. I want to rotate the scope. You see the scope? It doesn't want to rotate. So the reason why I'm getting you to learn this is hands close together, nothing much. Hold it tight. Hold it tight. Hold it tight. And the tighter I get him to hold it, and the further I draw back, you can see that the scope is now rotating. Bring it forward, get the hands close together, it doesn't apply such torque in the scope. Understanding that, it also protects you when you're actually thinking, do I need to apply a lot of torque, or do I need just to apply gentle torque? If I apply a lot of torque, I'm causing a lot of pressure in the bowel. That can cause risk to a patient. But you need to actually balance it with what you're doing. So even though how tight he's got hold of the scope, hold the scope tight like he did. So even though you've got it tight and I can't do, if I hold the scope here and do this, you find it very difficult to hold on. This is not doing anything. This is. Take this off, torque comes off. And how you guys scope is that you lean in as you're getting more frustrated. Stand up straight. Posture is very important. Shoulders square, hips straight, square to the patient. Next thing to remember is which direction you're pointing. The scope is here. Yes, we've talked about applying the torque. Yes, we've talked about applying the torque. The thing that I haven't talked about is, watch this, watch the tip, is if I look to the right, the scope will rotate. I don't have to look at it, I can see what it's doing, I can see on that monitor. If I look to the left, the scope will look to the left. So even the direction of your feet determine what the tip is doing. So now you've got an idea, we've covered a lot of basics in this short period of time. You now know what the scope does, you have an understanding of what the scope does, you have an understanding about starting, I want to apply clockwise torque, start uncomfortable, come comfortable, and then support. This is support, this isn't the driver. I want to go clockwise torque, I want to support it. I want to increase the clockwise torque, I want to support it even further. I want to keep shoulders, head, hips all square as possible. Feet direction also determines the direction of the hip, the direction of the tip of the scope. Yeah? Any questions? No? So here comes the big one. You'll hear me ask this a lot. Are you happy? Yeah? You don't sound convincing.
Still I'm confusing about